Hi, this is Dr. Martha Lucas, and you are listening to my podcast, 10 Minutes of TCM Training, the show that helps you build your practice 10 minutes at a time. And for you patients of acupuncturists or anyone who is interested in how Chinese medicine works, in my podcasts, I explain how acupuncture and Chinese medicine work. This is a special episode. It's longer than 10 minutes. It's about the treatment of headaches. So you may want to listen to it in sections. It's going to be an overview, the organ systems and how they relate to headaches, and then some point suggestions. And by the way, you can listen to my podcast, 10 Minutes of TCM Training, and my other podcast, Energy Medicine Woman, on my YouTube channel, Dr. Martha Lucas, and on Anchor and Spotify. So let's start with the treatment of headache using acupuncture. First of all, headaches are considered the most common patient complaint, and sometimes they are caused by an underlying disorder. Almost all headaches, up to 90% of them, are either muscular contraction, vascular, or they can be a combination of both of those things. Only 10% of headaches are due to systemic, psychological, or intracranial disorders. Migraine headache, which is throbbing and vascular, is the most widely studied of the headaches. It affects about 10% of Americans and is more common in females. In fact, there seems to be some evidence that there is some sort of a hereditary possibility of migraine headaches. Now, what are the causes of headaches? Chronic headaches are most commonly the result of muscular tension, and muscular tension can be caused by emotional stress, which is treated by acupuncture. In fact, one of my specialties is the treatment of trauma patterns to relieve physical symptoms. Fatigue can cause muscle tension. Something in the environment, like being at your laptop too long and having your arms or hands in a weird position while you're working all day. Or, of course, some women do get what I call period headaches, or muscular tension that's caused by or as a part of PMS, which, by the way, also can be cured by acupuncture. The normal period does not include any cramps or headaches or clotting. Anyway, other possible causes of headaches can include glaucoma, sinus inflammation, eye inflammation, some sort of actual trauma to the head, obviously, muscle spasms in the upper body, hypertension, high blood pressure can cause headaches. The causes of migraines is fairly unknown, but it seems to be associated with constriction and or dilation of intracranial or extracranial arteries. So that is one reason why migraine headaches may be the hardest kind of headache to treat. Now, migraine headaches are usually unilateral on one side. It's a pulsating pain. Lots of times before the attack, some people experience precursors like irritability. They might have a little speech disorder, like they seem a little, can't get the right word out. Some people have nausea or vomiting, and some people have photophobia, or meaning that light is very hard for them to handle at that time. The pain of migraine headaches is often severe and unrelenting. If it just seems like the person cannot get any relief at all. Now, usually the treatment is some sort of analgesic, but that usually only gives symptomatic relief. It doesn't treat the cause of it. And people take anything from aspirin to narcotics, tranquilizers like diazepam. Some people have to take muscle relaxants. Some people actually, caffeine seems like a remedy. But again, the causes and therefore the treatments of migraine is something that is constantly being studied in Western medicine and Chinese medicine. Now, in the treatment of headache in Chinese medicine, one of the things we always do is try to localize the pain. Asking the patient, where is the headache on your head, helps us figure out which channel or meridian, which acupuncture channel or meridian, the root of the headache is following. And also it may not be following a root or a meridian, but we always ask, where all my patients know I ask, where is the headache on your head? Also, with a pulse diagnosis, which is my specialty, training practitioners how to take better pulse diagnosis, make a more effective pulse diagnosis, we may determine whether the cause of the headache is deficiency or excess. Is it a hot or a cold headache? Is it caused by stagnant energy or empty energy? All of these yin and yang kind of divisions can help us determine what the cause of the headache is so that it can be properly treated. About 90% of headaches are caused by some sort of stagnation. Stagnation in the local area. Stagnation means the energy isn't moving. Oxygen and blood aren't moving. They're not supporting the muscles around the head, the muscles and the fascia or the blood vessels. So your practitioner is going to, or practitioners who are listening, obviously you're going to take the pulses and try to determine if there is a particular channel that's involved. Maybe you're going to check the shoulder, see how tight the shoulder is. Check the cervical vertebrae, see if they're very tight. See if there's any tenderness there. Is their spine aligned properly? Is it very tight around the spine? These are all things that you can be looking for when you're trying to determine where the stagnation is, like gallbladder 21 at the top of the shoulder. With people with headaches, that is very, very often very, very, very tight. And that can cause nerve blockage, stress, and the tightness of the muscle, basically, again, preventing energy and blood stagnation. If the eyes are involved in the headache, then in Chinese medicine, we would look at the liver and the gallbladder channels. Very often, migraine headaches, for example, do have some eye involvement. I can't tell you how many people have told me that pain is behind one or the other eye. There may also be tight neck involvement. Feeling the person's neck, feeling how tight that is, checking their face, poking around or prodding around their cheeks and seeing if there's sinuses. Maybe they have a sinus infection. If they have trigeminal nerve problem, that can also cause headaches. So again, we're looking as we're trying to do an effective diagnosis to figure out where the energy is stagnated, where the energy is weak, what channels are involved, and if there's physical pain. In other words, is the pain internal, or can the patient press on a point with their finger and show you exactly where the pain is? So that would be acupressure, right? And you can teach patients acupressure, by the way. I'm giving these acupuncture points, which for practitioners we would needle, but for patients, you can do acupressure on them, do your own acupressure. So let's look at, also, don't forget, as Chinese medicine practitioners, we're always going to look for the root. Okay, I'm going to give some points to do, but it is our job to figure out what is the cause of the headache. Is it a channel cause? Is it an organ cause? Is it a spine? Is it a tightness? Is it stress? Because what we need to do with all of our treatments is figure out the cause. Because if we don't eliminate the root of the problem, I guarantee you that the patient will be back in 1 or 2 months. And they're going to say acupuncture didn't work. So as practitioners, we need to always, always, always look for the cause. So let's talk about how each of our organ systems or organs relate to headaches. The lungs. A headache can be caused by the flu. So for practitioners, we would look at what stage of the cold or the flu the patient is in. If they are still in what we call the external stage, then we need to deal with the wind that might be causing the headache. If the flu or the cold has moved internal, then we're going to look at a different treatment. The heart. If the headache pain is dull and heavy It can indicate some sort of cardiovascular problem, but it can also indicate stiff neck. A stiff neck can cause almost any and all kind of headache. If the stomach is involved, the headache may be accompanied by dizziness or nausea and vomiting. If the spleen is involved, according to Chinese medicine, this may be an alternating type of headache. The pain may occur both in the back of the head and the neck and the chest or the diaphragm. And it can go from easing or light pain to a more severe pain. The gallbladder channel, this is the most common type of headache in Chinese medicine. And most of the time it actually follows the gallbladder meridian in the head region. So this gives the acupuncturist, the practitioner of Chinese medicine, information about how to treat that headache. If it's the liver, it's very similar to the gallbladder type of headache. And generally we don't distinguish between the two. For one thing, the liver and the gallbladder channels, vice versa, treat each other. So gallbladder channel may be more wind related and may respond more to wind or act up in the presence of wind. But a liver type headache is very, very similar to the gallbladder type. And remember, it may also involve the eyes if the person says the headache is behind their eyes. The small intestine is not generally directly involved in a headache, but it can be. So we need to look at opening up that channel. The small intestine channel is up around the shoulder blades. It goes up in the neck. So looking at that. A large intestine might be involved if the headache is accompanied by chronic constipation or diarrhea. And then or it might be some body toxicity if you think the headache is caused or involved with the large intestine. And then kidney headaches are often associated with nervous stress because and fear. Fear is the worst nightmare for the kidneys. We do not want a patient to have fear. So if the person is starting to get a weaker kidney channel, weak original qi, that can also cause headaches. If a person has a UTI, a bladder infection, that might be accompanied by a headache. And then the Sanjiao, which is also called the triple warmer, this can be kind of a intermittent headache. It's basically a problem with the Sanjiao or the triple warmer's ability to control heat in the body. And the triple warmer or the Sanjiao works with other organs. So using the Sanjiao or the triple warmer very often can connect all the centers and get all of the organ systems functioning a little bit better. So let's talk about acupressure and acupuncture. Now, acupressure would be, for example, as I said earlier, asking the patient, where is the headache? Can you put your finger on the headache? So sometimes that's called an sure point in Chinese medicine or painful point. And so let's talk about some of the points you would use to treat headaches. First of all, kind of a general basic acupuncture formula would be bladder 10, gallbladder 20, gallbladder 21, and do 20. So that might be what you do for all headaches. As I said, it's kind of a basic formula. And then you can add supplementary points according to the indications, like the headache is in the back of the head. Then you would add bladder 40 and bladder 60. If the headache is on the side of the head, you may add gallbladder 34. If the headache is frontal, add lung 10. If it's a general headache, you might do 24 or Sishin Chong on the top of the head. Migraines, you may add bladder 30 and gallbladder 34. If you have high blood pressure accompanied by a headache, always be careful when you're treating high blood pressure and anemic headaches caused by anemia. But you could bleed bleed, do 20, governing vessel. Dizziness in the head, maybe a mild pain, do 20, gallbladder 12 and 34, and Sanjiao 4. And then if you have a headache with red eyes, large intestine 4 and stomach 36. Headache in the back of the head, you can use do 14. If it's a frontal headache on the sides, Taiyang. Headache on the top of the head, Taiyang and do 20. Also gallbladder 12 and do 24. If you have a chronic or recurring headache, you might consider Ren 12, because I often think that headaches are caused by energy rising up too much. And if you treat Ren 12, then you're helping bring the energy back to the center, bringing the headache back down to the person's center or centering the person. You might be able to treat a mild headache with Sanjiao 23. If there's an acute stiff neck, you can do 16. If their headache is accompanied by dizziness, do 24, 23, 22, and 21. Gallbladder 19 and 20. Small intestine 5. Spleen 2. Bladder 62, 63, and 67. And stomach 36. If it's a headache just on one side, Sanjiao 23, gallbladder 20, Li 4, Ren 12, and stomach 36 and 41. If it's a headache due to wind, so we talk about wind a lot in terms of with a cold, that people are attacked by wind, do 23, 21, and 20. Small intestine 5, Sanjiao 1, and bladder 60. For a whiplash headache, you would needle do 16. Another formula for a headache with red face and eyes would be heart 5 and stomach 41. A headache with dizziness, Li 4, stomach 40 and 41, and gallbladder 20. If their whole neck is stiff and painful, you can do 19 and do 20 and large intestine 4. If their headache is along their eyebrows, bladder 2, large intestine 4, do 24, stomach 8, and stomach 41. And again, I have all kinds of prescriptions here. We'll continue with facial or frontal. I've already given you some, but here's another one. Facial or frontal headache, Yintang, Taiyang, lung 7, or you can try bladder 2 and Li 4, or gallbladder 14 and stomach 44, and or stomach 8. If the headache's on the side of the head, gallbladder 20 and Li 4, stomach 8, gallbladder 38, Taiyang, lung 7, gallbladder 39. On the back of the head, gallbladder 20. And you might do small intestine 3, or bladder 60, or bladder 65, or bladder 67. You also can do the combination of do 20 and bladder 67. Top of the head headache, do 20, liver 3, and lung 7. And again, around the eyebrow ridge, Sanjiao, some other ideas, Sanjiao 23 and bladder 62. Also, you might try gallbladder 14. So there you have a lot of information about causes of headaches, how they relate to the organ systems, and some acupuncture point prescriptions. Remember, every patient is different. Every patient's headaches may be caused by different unique causes to them. So your acupuncture prescription must be diagnosed and properly decided for that particular patient. I do not do what I call prescription Chinese medicine. Prescription Chinese medicine is akin to Western medicine, giving everybody the same treatment. We do not do that. We figure out the cause of the headache, the cause of the condition, using our expertise at Pulse Diagnosis. So remember, any suggestions I give to you in this podcast or in any class that I teach are not prescriptions for every single person. You must determine what is the cause of the headache for that particular patient. These are suggestions of points that you can use that have been shown to be effective to treat various kinds of headaches. Thank you for listening to this episode of 10 Minutes of TCM Training, even though this was an extra long one. I'm Dr. Martha Lucas, and if you want to learn more about what I discussed today as a practitioner or other topics, please visit my website, lucasteachings.com. That's the practitioner website. For the general public or a practitioner, if you are interested in treatment or other information that I share on my website, acupuncturewoman.com, I also offer global treatments, virtual treatments everywhere. Or you may email me at drmlucas@acupuncturewoman.com. That's drmlucas@acupuncturewoman.com. Thank you for listening. Take care. And if you can, take care of someone else too.